that are not yet here. So good afternoon, good evening, good morning, everyone, depending on where you're joining us from. It's always a pleasure to have you attend our daily lightning sessions. And today is the 19th of August, 2020. It's our third lightning session. And as always, as you join, we'll invite you to type in your city and your country in the chat so we'll know where you're joining from. And while you do so, please ensure that your message is sent to all panelists and attendees. So Dr. Uma Nazi from India, good evening to you. Unfortunately, your message was typed only to the panelists, so only Francois and I can get to see your message. Please ensure that you're typing to all panelists and attendees. The same with you, Aliyu Abubakar from Katsina. I guess that is in Nigeria. If you want to type your comments, please ensure it's to all panelists and attendees so that all those in the room will get to see your contributions. We also have our Q&A icon where you can ask any questions. The Q&A is for questions. It's not for comments or for greetings, but for questions. So if you have any questions, please type in those questions on the Q&A so we can get to them easily and read them out and see if we can answer them. It's the same thing. You can also type in your questions in the chat. I'm regularly taking a look at what is written on the chat, so we'll be able to get to those too. Greetings to you, Julian Adukuchili Kudu, joining from Jos, Plateau State in Nigeria. And hi, Francis from Ghana. Good to have you with us. Good evening, Joyce Washira from Kenya. So this week, we have one focus. We will have one objective. We have one goal, which is to submit the project on Peergrade by Friday, midnight Geneva time. That is our mission for the week. That is our goal. And where are we to submit that project? It's on Peergrade, the platform. So my question to you is, if you have you been able to join the Peergrade platform? So please, if you're already on Peergrade, I just want you to type in a yes on the chat. It's a quick poll, just getting to know if you have joined Peergrade. Can you type in a yes on the chat? So I already see one yes from Dr. Tanushri. That's great. Because the statistics we are looking at, so I see 2 yeses, 3 yeses, 4 yeses. That's great. 1 no. Yes, that's great. That's good to know. I see a no. There's Amsalu that's already submitted. That's wonderful. That's wonderful. And I see another yes. It's so great to know that a good number of you that are in the room have already joined Peergrade, and some have already even submitted their project. That is excellent. That is excellent. So this evening, we really want to get to focus on those who are having difficulties. Okay, Rashid says I've submitted. Rashid, this is just the week of submission. No possibilities of review yet. The peer review week is starting next week. That is as from Monday next week. So don't worry. If you have submitted, then congratulations. One thing I would have loved for you to be able to share your screen this evening and show us your project. But we really want to take a look at the projects of those who have not yet, or maybe who are facing difficulties. And I promised Dr. Tanushri and a few others yesterday that today we're going to, first of all, take them. So without much ado, I'm going to invite Dr. Francois Gaz that is with us this evening. And I also want to take this opportunity to welcome Shalini Kare that's joining us all the way from India. You're welcome, Shalini. Always great to have you with us. So good evening, Francois.
Good evening, Charlotte. I'm looking forward to hear, what the problem people are facing in filling the content of the model, which had been shared, and with a rubric to guide them to fill in. And as you mentioned, so here are the problems and see how we can help the participant to complete their task before the end of the week, where then it will be for the peers to review and comment and help to make their project even better. So over to you and participants for getting from those who have not submitted yet among the participants, where they are blocked, what the question they have for us, and looking forward to try to help. Then maybe we could have one participant who was submitted to share just for the sharing of this experience. It may be helpful for the participants too who have not completed yet. Over to you, Charlotte.
Okay, so thank you very much, Francois. So right now, I just wanted to invite Dr. Tanushri. So please, Dr. Tanushri, if you can unmute yourself. All right, so if it's possible, I don't know if it's you, tell us who you are, where you're joining from, and if it's possible for you to share your screen.
Good morning, good afternoon, and good evening. Charlotte, Dr. Francois, and Dr. Shalini, everyone who is there in this meeting. So I'm trying to share my.
Okay, so let me invite you to the panel. So just be patient a little bit while I promote you to the panel, and then I'll stop sharing the screen. But before I do so, I want to just copy and paste these questions on the chat so that those who are not presenting, you may want to answer the questions on the chat. So I'm going to stop sharing my screen now so that Dr. Tanushri can share hers. So Tanushri, I don't know if you've been able to, you have joined, I've promoted you to the panel, so you can now share your screen. Over to you. Dr. Tanushri, please share your screen. Okay, that's great. Okay, so you have the floor.
The screen was in and out.
Yeah. So am I audible?
Yes, you are.
Okay, thank you very much for giving me this platform. So today I'm going to share my ideas. So out of the 15 ideas that I shared in Ideas Engine, I thought that this was the most feasible one. So that's why I went ahead with this idea. It was that is mitigating the dropout immunization sessions through booking of sessions through the use of mobile applications or just a call. So the question that came into my mind, the challenge was that due to the COVID era, due to this COVID pandemic, the beneficiaries, they were very afraid to go to the immunization sites with the fear of contracting the disease, though that is cough etiquette and sanitization and as well as social distancing was maintained, but in spite of that they felt that when the health workers, they were getting infected and quarantined, so it was a way of contracting the disease and they were not very comfortable with the idea. So this led to a decrease in the routine immunization sessions, and that actually drastically fell. As we can see in the lockdown period. So what I thought of is that to make a way out of this situation, so this the system of booking the session has a, three-way help. That means the beneficiaries. It is a help to the beneficiaries. Why? Because we often know that the mothers are carrying their children to the immunization sites, and they like to do it after they finish their household work. When they're going at the specified time given by the health workers, they are either losing on their work or maybe losing on their daily wages if the mother is involved in some work or the other. Now then what happens is that why it is beneficial to the health workers is because the health workers at many a times we find that they are either less occupied. So at times we find that they are strolling around on the because there are less number of beneficiaries coming. On the other hand, we have also seen that they are too much overworked and they cannot actually handle the overcrowding that takes place at many a times. So this actually leads to a lot of problems regarding like the lack of vaccines at times. So this actually puts an anguish into the minds of the beneficiaries. Why? Because they have to again turn up again on another day, and those missed sessions are hardly tackled in the next session. So as a result of which we can mitigate this problem. And the third one is that it is also helpful for the policymakers. Why policymakers? Because many a times we have seen that the indicators or the goals that we are supposed to meet regarding immunization, that actually fails because of all these nitty-gritties. As a result of which, if we are reducing this kind of problems, then it is also helpful for the policymakers. So as I scroll down, so booking. Now, how this booking will be achieved? Now, the booking can be achieved through their normal phones, because we know that everyone these days have a normal phone. Now, here lies the the expertise of the IT professionals, who will be helping in a way that they will be putting some technology, some poll questions or something like that, or some apps rather, which by the help of which the mothers or the beneficiaries, they can book their own immunization sessions. Now, it is very practical in today's COVID pandemic, because we know that we want to avoid this situation, this contracting the disease, this overcrowding. So in a way, there will be distribution of people coming, that there will be an even distribution of beneficiaries coming to the session sites. And in a way, when we know that the lockdown is there and all hurdles are there, so the health workers will also get a momentum, where they can where they can provide the vaccines without any hurdles. That means there will be an ample supply of vaccines, and no mother or no child will be they will be sent to their homes without receiving their actual vaccines. Because many times we have found that, suppose a mother comes with a child for the measles vaccine, where it is also supposed to get vitamin A, but what happens is, majority of the times vitamin A is not in supply, and the mother has to again turn up another day. So that creates a lot of confusion as well as discomfort. So in this case, I have described that what are the things that I need to do. For example, before this idea can be actually implemented, it has to be written as a concept note, and it has to be percolated to the policy makers. Now they have to get the detailed project report, and we need to get this support from them. Now then comes the creating awareness. How I'm going to create the awareness? Now it could be in the form of some replaying in televisions, or maybe on radios, so that there is social mobilization, there is community engagement. And on the other hand, we can also involve people by some video recordings of role plays or maybe street plays, and then we can display it again and again and again, broadcast is again and again, so that it gets imbibed into the minds of the people, that is possible. Then something about this idea generation, that means there can be certain NGOs who can advocate these ideas. There could be some sit and draw competitions, marathons, who can through that these ideas could be percolated into the public. Now we can take the help of some celebrities rather, who can advocate these ideas. And as I have already told, that there will be IT professional help. And obviously this software, now this software would be like that. Suppose if a mother, suppose I am a mother, and I want to carry my child to a health center for immunization, maybe on Monday, so I can book it from here. And suppose if I fail to turn up on Monday, then the information that goes from the software to the dashboard, the health workers will automatically ring me up and ask me that what was the problem, why couldn't I turn up, and what is the next date where I can go and take the vaccine for my child. Now then in many cases I have told that software application software. Now many a times many people, they are not having smartphones. So what happens in a normal phone, the mother, suppose many a times we have encountered that the calls, they get get disconnected. So what to do in those hard to reach or hilly terrains? So in those cases, the mother can send SMS, and like the way we get information on Telegram, so it is percolated to so many people at the same time. So that information will go to the dashboard in the local language, so that the health worker, suppose if health worker 1 misses it, automatically the other health workers can follow it up, because it will go like a Telegram message, so it will anyone can access it. So such chances of missed immunization will be reduced. Now on the other hand, now we need capacity building. Why we need capacity building? Because the health workers need to know about this technology, as well as the beneficiaries also need to know how they can operate. So we will give a training for those people. And I have thought of some incentivization, because without incentives it becomes very hard for anyone to do some good work. So like the way we have some programs running, that at the end of the immunization we can do one thing, that we can give the health worker that on complete immunization she will be receiving a token of rupees 1000, and the beneficiary a token of rupees 500. So now the question comes is that who will fund all this thing? Now it can be by the government, or if the government says that we want some funding agency, so we can write to Bill and Melinda Gates Foundation if they're interested, or maybe we can call for some corporate social responsibility, CSR schemes from the private industries. So then now there was a question about monitoring. Now, how I'm going to monitor whether this mechanism is working in the right way or not? So there can be some indicators. So for example, it could be improvement in the percentage of immunization services coverage, then increased satisfaction score of the healthcare workers on Likert scale, as well as increased satisfaction score of the caregivers or beneficiaries. Now you may ask that how I'm going to take this score or do it. So we can conduct maybe poll sessions on maybe on the phone, or maybe we can conduct a focus group discussion over Zoom, or we may take an in-depth interview on Zoom or maybe Google Meet. And in this especially in this COVID pandemic, where face to face conversation is rather difficult these days. Now then we can monitor through the decreased percentage of children suffering from acute respiratory tract infection, diarrhea, malnutrition. So these are the indirect indicators, I would say. And there may be reduction in the rate of dropout cases, sustained coverage of the vaccines, maybe 90% or greater. And then these are certain goals. Apart from those, we can also monitor the country specific goals, like improvement in SDG indicators, the sustainable development goals, the millennium development goals, the reduction of infant mortality rate, the under 5 mortality rate. So these are all connected with immunization. And then the main thing that came into my mind was that yes, now there are certain ways we can collect we can monitor this. How we are going to monitor this thing? Suppose when we are putting it in the television, so the number of people watching it, so it can be monitored through TRP ratings. Now then the other ways that I have wanted to mention is that the trainings that we will be given. So how effective is the training can be calculated by the on the number of completion certificates achieved by the health workers, or maybe the number of trainings the beneficiaries had attended. So these are some of the things that we can monitor. Moreover, this we have a system running in our country called Kayakalp, where based on the infrastructure of the hospital is being given an award of a certain amount of money. So we can pilot it in some places, districts or hamlets, and then we can also apply the same thing, that which is the best performing one, and we can give some reward system for those things. Now, for data collection, we can take the Kobo Collect software. I think that it operates without internet. And I have a plan. This dashboard will be connected with the GPS or the GIS system, so that at a go, the policymakers can see how is the progress done. Now, why I thought of this phone? Because today we are talking about going green. That means paperless things. So this is good, because many a times what happens, the mother comes to the immunization sites, and often the immunization card is torn, or it is lost, or something like that, and the mother is told that since you are lacking, you're not having this card, so we cannot vaccinate your baby, or we cannot document that. So this kind of an hassle will be reduced to a great extent if we are going, because the moment the child has been vaccinated, this will be automatically put into the dashboard, and it will go into the system, and it will be stored there, so it can be retrieved any point of time whenever the policymakers or whoever the health workers want it, they can do it. Now then, the other thing is that since this is connected with I have thought of connecting it to the inventory system, because we know that many a times the vaccines, they are not available. So suppose if I am going on Monday, so by this 3 or 4 days, the health workers, they can make the indent if there is a shortage of vaccines, and they can automatically make it ready for the next session, that upcoming session. And then on the other hand, what we can do is that we can, yes, there is an idea of video recording. Suppose we may cite one case, or a success story, and we can video record it, and we can percolate, or we can circulate it, so that people can see it, they can ingrain in themselves, they can be much more confident, and they will never be afraid of this thing. So that will again add to the advocacy part. Now, regarding this thing, the references, I would say that I have found my ideas to be similar to many of the peer scholars. Like, for example, I would give help, thanks to Dr. Baba Saheb Tandale, Dr. Maladesh, Dr. Timothy Gachanka, Dr. Yusuf, who has talked of Zoom meetings and training, and Isa for the data collection. He said that can be through tablets, smartphones. So I thought of Kobo Collect, and there are other softwares also we can think of, which can take the help of the IT professionals, will be helping about this thing. And apart from that thing, we have other documents from the WHO website, the GRIS document. So they also helped me a lot. And regarding the other thing, according to the what should I say, the rubric. So I pointed my work as to be part one to be four: prioritize, challenge, and compelling specific goal, supported by convincing, concise justification. And regarding the next part was part two, taking action. So it was action steps require major improvements. So I put it like that way. And regarding the references, the current level of work, it was three. Some elements are credible or feasible, but require minor improvements. So this is all that I have for me.
Thank you very much, Dr. Tanushri, for that kind of like very rich, in-depth, well-researched project. Before I invite Dr. Francois Gaz for his questions and opinion concerning your work, I just want to say, please, if there is any indication of your name in the document before you submit it on Peergrade, because it's part of the code of honor is that everything's supposed to be anonymous. So if your name is figuring out anywhere in the document, please just make sure you take it off, you delete it before submitting the final version. Also, if there are some acronyms, some abbreviations that you have used, it may be important to define them. And then I also saw that it's as if you did the peer review of your own work by okay, so you may want to take that off too. All right, so I'm seeing people are raising and putting down their hands. So there's no hand raised, and we don't really have any comments on the chat. So Francois, over to you.
Thank you, Charlotte, for giving me the floor. And thank you, Tanushi, for describing in really in-depth and with so many details your project.
Thank you.
it's hard to find out any details that's not in your project. If I go back to your specific, I think you are very clear on your project and very specific. And I congratulate you because this is really clear. Your goal is, and I think you have described very practically your challenge, and you have set a very specific goal, and which is quantified.
Thank you.
Now, when I go to the actions you have taken, it's really comprehensive. You have listed so many things, and I know you are at, you must be at state level for West Bengal. West Bengal is a big state.
That's
How
right.
do you, I'm, I wanted some clarification, given your level, how are you going to implement all those activities with whom and how long it will take? Because it's quite a massive undertaking you have listed, being at your
Yes.
level and focusing on community health workers, health facility and communities. Can you clarify a bit more how you're going to implement that project in practice? That's my first question.
Thank you, Dr. Francois. It's actually a very good question. Since I work in the state level as a policymaker myself, so I work with the bureaucrats. So it is like the first step, that is putting a concept net to the policymakers, is quite easy for me, as I am working hand in hand. Number two is that is seeking IT help. That can be achieved because I represent one of the Department of Science and Technology. So there I can ask for funding, and at the same time we work with NIC, the National Informatics Center, which is it is actually a hub of IT professionals. So I can ask the IT professionals there to work with us regarding this thing, regarding this implementation on a grassroots level. And number three is that regarding the advocacy part, we have the IC cell, that is information, education, and communication. So they are also working with us. So we can always talk with them and seek their help regarding the advocacy through advertisements, through seeking advocacy through other modes like street plays and role plays and all the other things. And since I am also attached to the academics, like I'm an associate professor in so I can in community medicine, so I can always arrange for this focus group discussion that will be held by my students, both the undergraduate as well as the postgraduate students in the medical colleges. So they can arrange for those things. They can also arrange for the in-depth interviews. So I think that most of the things that can be covered from my point of view. And the other thing is that I will try to implement this first in a pilot phase from the immunization clinic that we have in the medical colleges. Like that will be a smaller version. So I'll start from that thing. We have immunization clinic in the medical colleges, in the medical teaching institutions. So we can start from there. If we are successful, then we can roll out on a large scale. And on the other hand, I think this is how I have thought of it. And other thing is that I can also involve, since I am into the different departments, so I can talk with the different departments, and I can take their help if they're willing to volunteer, like the school teachers, those who are willing to work into this thing. So I think on that basis we can.
I think, yeah. Tanushi, I understand very well. I think your idea of booking and a dashboard and following with just a call, I think is a great idea. Problem for me, which I don't see clearly from where I am, is really the implementation. All the challenge of making your idea work and going statewide. And the time is short. You have a lot of work. There's not only your piece of work, but there's everything else that West Bengal is doing to
Yeah.
maintain immunization. And
Yeah.
people may not have all the time in the world to do your project, which could be almost a master thesis.
Mm.
What you are describing in depth, and you really master all the elements. I would suggest that you try to simplify, to give it a chance to work. You have raised the issue of piloting, which is an excellent one. and going to scale afterwards. The second would be to try to simplify. And just to illustrate, I think you have listed a number of indicators to monitor your progress. If you had to choose only 3 indicators, what would they be? You know, make sure that the simplest, I've seen the list of indicators, which each, and some of them are not inside your information system. You have to conduct special surveys or rapid studies. And I think you know, I see number 7, which is a very good monitoring. If this work, your coverage is achieved, and your number 6, well, the dropout number 5, well, is also, the rest becomes a little bit long-term, a bit less specific and more complex to address. So go simple. What would be, choose the 3 most important 1 or 4, and let the rest, if you can, try to make sure that your project get implemented. The challenge of good ideas is always in execution. Execution will come if it's simple. You know, we try to make, if you had to make your project in 2 pages, what would you delete? How would you keep the critical element? That would be my suggestion. Otherwise, you have gone really in very much details, and that's, you know, it's hard to get more into depth in your project and your great ideas. Just get an idea of simplification for the sake of people who will implement it later. Thank you.
Thank you. Thank you.
Thank you very much, Dr. Francois, and thank you very much, Tanushri, for taking up this exercise and for really going through every step of the rubric, so that I'm sure so many people in the room have been helped and have been edified on how they should tackle the project and the different sections that have been need to be filled as far as the rubric is concerned. And I totally agree with Francois when it comes to like bringing out the most. I was going to suggest that you take out the priority, the topmost, and the most essential information, because for one, it's going to be helpful to you, and it's also going to be very helpful to your reviewers. And there's someone that was asking that if you've already submitted your work, can you go back to edit? I think Peergrade give, as long as the deadline is not yet passed, that is Friday midnight Geneva time, you can, I think you can still do editing. Shalini may correct me if I'm wrong. Shalini, is that the case?
Yeah, you can edit your assignment if you want, or you can delete it. So there is a change and a delete button if you check on Peergrade, and you can do that before Friday. As you know, the deadline is before midnight Geneva time. So what you need to do is edit your project or on the Word document on your laptop, and then you can upload it. I hope that helps.
Thank you very much. Thank you, Shalini. Jaffa Sani, I hope that answers your question, because I'm sure your question is you have already submitted your assignment and you may want to edit it. All right, so there is a raised hand from Kuraju, and also Dr. Tanushri. So many people have been appreciating the work that you have done, and you can see their comments on the chat. So we are really grateful to you for volunteering to share your screen and present your work. So Kuraju, your hand has been raised for a while now. I'll invite you to unmute yourself. I don't know if you want to present your own work or to ask a question to Dr. Tanushri. So Kuraju, please, if you're getting me, I'd like you to unmute yourself. All right. Good evening to you, or afternoon, depending on where you're joining from.
Okay, good afternoon from the Gambia.
Good afternoon.
I am Kuraju. Yes, what I want to do is just to share the work I've done so far, so that I can have a guide on what I'm, if there's need to improve on.
Okay, so please, Dr. Tanushri, can you stop sharing your screen?
Yeah.
Sure. Yeah, and then I'm going to invite you, Kura, to the panel so that you'll be able to share your screen. So you'll be rejoining in the panel, and then you can share your screen with us. Okay, and while you're doing so, I see a very interesting question from Eda Khan from Kenya. I see a quick question. Should we choose the actions that are quick to implement, that's the low-hanging fruits, or the long-term ones? Francois, what do you think? I think that's a good question.
It's a very interesting question. You know, if the problem is, what are you solving when you take the low hanging activities, the possibilities? Are you going to make an impact or not? Now, if it's easy, not costly, take it. But I think you need to review those elements and decide which one carries the maximum weight and which one is doable and feasible and will contribute to the success you try to get. I can only illustrate one comment I heard in a meeting where people said, in polio eradication, if we had started by the most complicated country, the world would and succeeded, the work would be done, the rest would have been easy. But I think it's not that simple. And I think you need to review if the low-hanging fruits, as we say, usually are easy to collect and have a little impact, do it. If it's low-hanging, but it takes time and money to do it, you will have limited impact. Go for another fruit a little bit higher hanging. So it's really an analysis of your situation. What are the main cause of your problem and which one can you address? Don't have too many problems to address, too many causes to address, or it will take a lot of energy and time and money and you will achieve very little. I think the sense of prioritizing that you are raising is extremely important, but you need to consider different elements. The cost of it, the impact of it, and it is really doable. When you say low-hanging fruit means doable, but will it have an impact? And what size of impact will it be? But prioritizing is key. Am I helping a bit?
So I hope you've been able to help Ada Khan with your answer, Francois. So right now, yeah, she said maximum weight, doable, feasible, and cost. Thank you very much. So that's the response from Ada Khan, and I have the real pleasure of being the one to read out these messages to you, Francois. So I'm going to invite you, Kuraju, right now. Please, can you unmute yourself? You are on the panel, and you have the possibility to share your screen. So over to you, Kura.
Thank you very much. Good afternoon. I may not be able to see my screen. I'm sorry about that because I'm connected through my phone.
Your phone, okay, I see.
Yes,
I'm just going to paste the questions, the set of questions on the chat. So you go ahead, please.
Yeah, so as I said, I'm Kura from the Gambia. I am working at the Regional Health Directorate. That is, we have about 7 regions in our country. So I'm working in one of the second biggest region. We are responsible for coordinating immunization services and other public health and health services within the region. So specific to the challenge that we have is we were looking at the dropout rates, which is one of the indicators looking for looking at the dropout rates, looking at since the period on the review. The period on the review is the period, the second quarter of 2020, because COVID-19 started in the Gambia. It was declared on the 23rd March 2020. So since then, that was in the fourth quarter. And then when we reviewed I reviewed the data, I realized that from the second quarter all throughout the 3 months, compared to previous second quarters of the 5 years, we have seen a decline in the in dropout rates, especially for utilization. We are looking at MR1, which is measles, and also during the period of the pandemic, we have seen positive cases of measles. So because of that, coupled with the low outbreak, we want to specific to be the challenge we want to take up is specific to measles. That is how best do we ensure that the kids are due for measles and they are well vaccinated. So and for us, the challenge we want to take up is called community-led action. we feel that the community has a crucial role to play in terms of trying to reach out and ensuring that these things happen. We may do the groundwork at our level, but the community have an important role to play. So this is the justification that we have been seeing high dropout rates, and we have seen some positive cases in the community. Regarding, that was why that one was prioritized. So the actions that will be taken will be in 3 thematic areas. The actions that are going to be taken is going to be in 3 thematic areas. One of them is community-led action, that is from the supply side of the immunization services. And the second one is on supply side, that is health workers, that is going to be on monitoring and evaluation to make it more simple. On the community-led action, what we want to do in detail is to look at, looking at our existing structures. We have some local community health workers. We also have religious leaders. We have also mothers who are very influential. So we were also fortunate using the already existing structures. We have what is called the risk communication and community engagement at all levels, from the national to the regional to the district levels. And they've all been trained on community engagement. And one of their deliverables is for them to help communities come up with their community action plans. And in those community action plans, one of the thematic areas is going to be a continuity of service. So what is already existing, from that continuity of services, we want to now bring out immunization services as being one of the areas that they will really have to work on. So communities will, with their structures, will be able to come up with a strategy of how they want to engage. We give them we're not going to tell them anything. All we do is to use a strategy that we were trained on by UNICEF, which is called body mapping. That is all about helping communities to identify their own problems and coming up with their solutions. And you do your M&E and monitor them for the implementation of their plan. So basically, that is how we intend to do it. And these things have already been started. They are ongoing. It's already in place. So it's just a matter of trying to see how best to implement them so that they can try to make some impact on ensuring that all the kids who are due for measles vaccine, that is MR1, they have their vaccines. Even if they don't come, we also have another system in place. After talking about the community-led action, this is the level of the community. Now, when you come to the level of the health facility, we will also continue to do supportive supervision and engagement of the community, and for them, the health workers who are responsible for the tracking side, ensuring that all tracks that are done at that are due both at the base clinics and those are at the outreach continues to be conducted, and also continue to engage the communities and talking to them on the importance of coming for immunization services. This is going to be led by the health workers at district level, but sometimes they may not necessarily go, but they have to engage some of the influential members of the community, like the imams, the religious leaders. You have very influential women in their communities that the women listen to. And also when you talk of women, also they have most of the burden of taking care of kids in our country is run by women. You also have groups where women lead. So we want to look at those icons and also the healthcare workers at that level to come in and work with our healthcare workers to sensitize them. The third component, which is very crucial, is that M&E component. The M&E component will be divided into 3 phases. The phase 1 is about how do we monitor what is done at the community level? That is just in terms of both at the output level and at the outcome level. For the output level, we now want to see how many of the planned activities that is ranging from engaging the community, how we have we successfully. We have a target of about engaging in each community. We want to engage 7 of them. So out of those people, were we able to do that? That is going to be output. Out of that output, one of their tasks is for them to be able to refer mothers to the clinic, links them up, go for active case site. Like we are doing active case site, it's also another opportunity when we go for contact tracing. So it's like what is already existing, you use it to get what you want. So we do the contact tracing, and also when they go out there, they're able to also find out, do you have any kids here? What are their immunization status? Are they coming out? So that one is at the level of the community. So we will look at the output and the outcome. Are they really referring? And all those people they have referred if they've been vaccinated. Now, when you now come to also, we talk about also at community level, how many of the planned activities have been conducted. So now when you come to the health facility level, We have what is called the My Child solution in the Gambia now. It's been piloted in my region, and we are thinking of scaling out. It was done by CFO Foundation. Now we have all our kids that are vaccinated is electronic. So if we just have a paper-based system where you have a form when the child is come for immunization card, you have the record card. You also have what is called the child health record. When the health record, that is where you record all the details of the child, the biological, the biodata and everything. So once you come, that is scanned, that is uploaded and it is there, and the child is given a unique ID. There is another form that is called the child records. So that record is only responsible anytime you come for vaccination. If you have any vaccine given, it is tallied. So once it is tallied and the code of the child is there, when it is synced and scanned, it goes automatically and is matched to the child's number. So, and at the end of every month, it will generate a report. And when that report is generated, it will give you 16 key performance indicators. That is the dropout rate. We talk of, even because hepatitis B, if it is given in the first 24 hours, is very important. So we are able to monitor all this. But specifically, what we will be looking at for this project is MR, how best we can ensure that these kids have these vaccines on time. So specifically, the project will be looking at that. So with that, the health workers also have their contact details of this mother. So they can also call the village health worker and say, well, this is a mother I have. Well, can you please go to the school and follow up? So because it is a community where people interact a lot, these are mothers who are not coming. So it's in your own catchment area, can you please follow up? You can also call the mother. So basically, this is how we intend to do it, to ensure that we create demand in the context of COVID-19. We continue fighting against COVID, but we also try to ensure that we don't end up having some outbreaks of measles and all that, because we've already seen some few cases. And also comparing the second quarter, which was the period on the review for the past 5 years, we realized that there is a drastic drop in the number of children that are supposed to receive the immunization service. In a nutshell, this is what my project is all about, and I hand over the baton. Thank you very much.
Thank you very much, Kuraju, for the clarity of your presentation and the detail too. So I just have one question. Have you already submitted your project?
Not yet.
Okay. So I remember you said earlier you wanted to get feedback so that you know how to improve. All right. So thank you very much. I'll just invite Francois. Francois, over to you.
Thank you, Charlotte, and thank you, the name I don't remember, but the Gambia, for the Gambia experience shared. And I think I would say that I like the focus of the Gambia, which is focusing on the dropout rate, that automatically it would improve coverage. And I think you have very well analyzed the problem. The only maybe element that needs to be added is really what are the main cause for mothers not to come. I think we are aware globally that mothers fears to be infected, mothers, health worker fears to be infected by mothers. And if there is a case, mothers don't come, and there's conflicting of messages, stay home, but now get immunized, at least go for immunization. So I think you should reinforce a little bit what are the main cause. You have been very detailed in the action you want to take from the community perspective and from the health worker perspective, and this is great. And you went into a lot of details, and you even went into the details on how you're going to monitor. You have obviously, read very attentively the rubric, the guidance has been written, and you have covered most of the elements. Now, my only question is on the doability. Bon, Gambia is not a big country. You're working in one region. How long will it take to implement your project in practice, that all the actions you have listed and the tasks you have listed, how long will it take to implement in your region?
Now for the implementation, like it's ongoing, but for the ones that we have already, that I already highlighted here, our duration is for 6 months.
And your goal, you didn't specify the goal of the reduction of the dropout rate. Where are you
Yes,
today,
yes,
and where in
yes.
6 months?
In 6 months, we have about 40% dropout rate from the analysis we did compared years. Dropout
Means
rate of
when you say dropout, the dropout is
for MR.
40%, or is it for
Yes,
MR? There's a
yes,
drop for MR
yeah.
for the second dose of measles.
The first dose, MR1.
Which one?
MR1.
MR1.
Yes.
Okay, and that's 40%, which is, and does it take really a special, you mentioned the action, so do you have also a dropout for pentastry, or is it MR, your indicator of reference is MR?
Yes, we have dropouts for all the antigens.
You have a dropout all
Yeah,
antigen. So
but
maybe
because of
useful to monitor the dropout of all antigen and not focus on only one.
okay.
And that may be very useful, and to set where you are and where you expect to be if you implement successfully all your action. Otherwise, I think it's a very clear and stepwise with all what you do and how you're going to do to make sure from a health worker perspective and from the community-led action, as you said. Make sure on the community-led action, you are very clear on the task you have to do to implement, because it will be useful for everybody else who may be interested in understanding completely your idea, but obviously you are mastering the situation. Thank you.
Thank you very much, sir. Regarding the issue you've asked about why the models, because we do what is called rumor logging. When we have radio programs and community engagements, we just go to the radios and seek the opinions of mothers. Why do you think so? A lot of issues we are talking about, as you've mentioned, one of them, people are afraid of coming to facilities because they feel that that is where they can get the COVID. Some of them also, they also have a misconception that there are some local people who are going around that if you go there, there is this COVID vaccine, they will test it. They will may use your child to test the vaccine. So some of them might be afraid to come in. So we've been able to listen to them, and some of them are afraid to come. And there was a time also, there was this policy decision that was not very clear as to whether we have to stop. And some of them, and there is also a rumor that saying that this is a number, they are only, if you go to this facility, they are only taking 100 a day. So some of them will say, well, if I go, if I'm late, so there is nothing so much clear about, a lot of misconceptions going on. So we have to do a lot of risk communication coupled with the engagement to clear some of those myths and also rumors happening in the community. Yeah.
And you mentioned risk communication. Try to go in detail on how you're going to address those risk communication. That will be extremely useful.
All right, thank you, sir.
Thank you very much.
Okay, so really thanks to you, Kura, and thank you, Francois. You know, it's been such an enriching, I don't know, it's such an enriching session today, and I'm sure many of those in the room will agree with me. And you're getting some, there's Peter Ehi Zibolo that says on the chat, presentation detailed, convincing, and systematic. Well done, presenter. So that is for you, Kura.
Thank you.
And yeah, so thank you very much. It's 7 minutes to 7 p.m. Geneva time, and I just want to take the last few minutes because we're constantly getting questions of people that, how do I post my project? Where do I submit my project? How do I submit my project? Some people are even sending us the project by mail. Please do not send your project to the Geneva Learning Foundation by mail to the covid@learning.foundation email address. That is a violation of the code of conduct for the Scholar program. So please, I just want to guide you. We know that technical support sessions are going on daily from Tuesday to Friday at 11 a.m. Geneva time with Alain Blaise Tatsinkou. So if you're having any technical issues, you can join those sessions. But I just want to take the last few minutes to help those who are still asking themselves where they are supposed to paste their project. So everything happens on the learning.foundation platform. Everything happens here. And if you come on the landing page of the COVID Scholar Peer Hub Exercise 1, all the activities are detailedly spelled out. week after week. We have the Ideas Engine week 1, and then we have the reviewed project week 1. You have here a set of videos from Reda telling you how to download the template, where to download the template, how to download the rubric, how to complete the first part of your project, the second part, how to cite references, every single thing. And then for this week, the most important post is how to submit your project on Peergrade. And I just shared the link to this particular post on the screen. Here, we have noticed that many people in the room right now have not yet joined the Peergrade. Peergrade is the platform where you submit your project. If you don't submit your project on Peergrade, it shall not be peer reviewed. And the project is one of the certification requirements. You're going to lose your certification. So it's very important that you visit this page, go through the video, go through the guidelines on how to submit your project, and then join Peergrade. So there is a message from Shalini on the chat that is saying, if you are here, many people answered no, that they are not yet joined Peergrade. So if you have not yet joined Peergrade, please, can you contact Shalini? And she's also congratulating the presenters for the great presentations. So she even pasted her contact address in the chat. So Shalini, if you can still her contact number in the chat. So Shalini, please, if you can still do that, we'll be most grateful. So you can contact us, you can send us a mail, and we'll be delighted to help you out. So right now I'm sharing again the link to this platform on how to submit, or to this tutorial on how to submit your work. And you need to create an account. If you have never been on Peergrade, meaning you have never done a Scholar course before, you need to create an account on Peergrade. And if you already have an account on Peergrade, you need to access the classroom that is set aside for the COVID-19 Peer Hub. And the class code is here. You type in this class code to access. Please follow all those steps. If you have any difficulty, I'm also typing in my WhatsApp number on the chat, so you can also contact me by WhatsApp, and I'll be delighted to give you the support that you need. So that said, I really want to thank all of you for joining this session. I'm just going to invite Francois for closing remarks, and then later on, Shalini, who is going to close the session for today. So I'm looking forward to meeting you tomorrow evening at 6 p.m. Geneva time. Until then, stay safe. Francois, over to you.
Okay, thank you, Charlotte. And I want to say a big thank you for the presenters, because they went into a lot of details that we rarely see in the presentation or in the project. I was almost thinking that it is so good that it may scare some people who are not facing, who are scared to see how many details were in the project and may be a bit worried. But I would like to say that they should not be worried, because the one listening who have not that level of details, I think you need to be concrete. You need to make priorities. We cannot do every priority task that will make the idea happen without achieving 100% success. Good management is prioritization. And so don't be worried of really, as we discuss, what are you going to do that will have a contribution, carry a weight, the feasibility, the not costly, that can make a difference. If it does not make the whole difference, that maybe some of the project presented may do all the difference and achieve 100%. But it's a lot of time, it's a lot of work, and the challenge remains a risk not to achieve everything, and prioritization will help you. So congratulations for the one who have presented in such many details. It was very interesting to see. Some were very sophisticated, like in West Bengal. The approach is a very modern one in the state of West Bengal that unfortunately many areas of the world can't afford. But congratulations again. It was, for me, it was very interesting to listen to your project. And good evening. Thank you very much.
Thank you, Francois. Shalini?
Yeah. Thank you, Charlotte. It was a fantastic session, and thank you, Francois, and to the presenters. I agree with Charlotte. It was really enriching to listen to you all and to the details that you all gave us. We hope that you enjoyed the session and all the advice that you got from Francois and Charlotte. And the last thing that I wanted to say, since a lot of you are still not on Peergrade and not sure of where to submit your projects, so please do reach out to us. You also know that there is a session tomorrow by Alain, and you can always join the daily technical support session, and where, you know, Alain takes you through on how to go through various platforms and how to navigate. And as I said, and as Charlotte said, please reach out to us. Don't feel shy, and immediately get in touch with us if you have any issues in getting into the platforms or any confusion. So thank you all very much. We hope that you enjoy the rest of your day. Stay safe and have a great day. Thank you and good night.
Good night to everyone. So I'm just sharing with you, letting you know that the recordings for all the past sessions, the General Assemblies, the technical support sessions, and the daily lightning sessions, if you have missed any one of them and you want to know what has been said, the recordings are available also on learning.foundation. So goodbye and thank you so much for your patience. See you tomorrow.